Well, hi everyone, this is Dr. Schroeder with this week's video introduction to week number 6 of our course in Nursing Theory and Foundations of Professional Nursing. And once again, a very nice discussion this week. There's been a lot of work done in class, and so my hat's off to everybody. There's a lot of work in this class. I just want you to know that, more so than I think than a lot of classes that are out there. So just be aware that as you get through the program, I think that sometimes the classes get a little bit thinner, a little bit more focused, because we've really been talking about a lot of different things in this class. And of course, in week number 5, the topic was to talk about your professional development in nursing and how you see your experiences and what you've been learning thus far, how that has impacted your view of what it is to be a nurse. And we talked about this concept of social obligation and how one of the things that makes nursing a profession is that we're not just a profession, or we're not just an occupation where you work 8 hours, punch a time clock, you go home, you hang up your hard hat or whatever, and then you go home and you're whatever you want to be. Nursing is something that, from this altruistic point of view, it's really something who we are all the time. We view ourselves that way. Our decisions are all made, and in many ways, our ethical decisions are made through the lens of what it is to be a nurse. And so this concept of social obligation and in some contexts, even social justice gets pulled through this nursing lens, and all the nursing theories reflect on this somewhat as well. So it's a lot of different ways you can go with this discussion. Discussions were very lively and very free-flowing, and that's exactly what they really need to be, I think. Many of you had described and discussed your own personal journey as a nurse. With others, it was a little bit more pointed as to how specific aspects of the class or your professional development were maybe impacted by a mentor or by a particular experience you had, and that's all really good. That was really the idea here. It's going to be something that you're going to touch on over off and on, actually, throughout the program, is how are you growing, how are you developing as a nurse. In week number 6, no assignments this week. You do have a discussion question, of course, and the discussion question is for you to go to your individual state board of nursing, go to their website, and review their either their bylaws or their Nurse Practice Act. It uses different terms in different states, and see what does it say. What is the definition of an advanced practice nurse? One of the things that we'll find, this is something that's really interesting for me, because as I've taught this class many times in the past, I've always been surprised how different the different state boards are. What we have here in California, where I primarily practice, California and Arizona, is much different than what you have in New York, or much different than what's in Connecticut or Florida or Nevada or many other states. It's really kind of all over the map. And the concept of advanced practice nursing is something that it's really interesting to look into, because different states look at it differently. And so that's going to be the topic of conversation this week. I have completed grading all of the concept analysis papers. Well done, everybody. That's a big assignment, and it takes a lot of time to do that. And so my hats off to everybody. I did give a lot of feedback to all of you, so please review my feedback. And as I posted in an announcement, remember, feedback is just feedback. You can't really get better on something that you don't get feedback on. So please know, my desire is not to make anybody feel bad or to make anybody feel like they didn't work hard, or why am I, sometimes it may seem like I'm pointing out a lot of negative things, and why couldn't I say more that was positive about it? And it may seem that way just because there's a lot of little nitpicky stuff when it comes to things like formatting correctly in APA, getting the headers correct, and getting the correct format down. Some of you, it's clear, have written before, and it seems like it's a fairly easy process. Others, the writing process is relatively new. So I try to give feedback to try to help you. Please, 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 I just want to be, I want to make sure that you get what you need so that you can improve. So if you have any questions about my feedback, or especially if you see that I wrote something that maybe sounds like different than what you've heard in the past, or just didn't seem clear or whatever, please let me know and I will work with you on that. So that pretty much wraps up. We're through a lot of the heavy lifting for the class. You have a presentation coming up due, I believe, in week number 7, and some more discussions. So still quite a bit more to go. But discussions have been great overall. I think that we're really where we need to be. So I look forward to seeing you in the discussion forums. I don't have the heavy grading this week, so it kind of leaves me open to spend a little bit more time with you in a discussion forum, I think. It takes a lot of time to grade those papers. So you'll see me a little bit more visible in the discussion forums this week. But I look forward to seeing you there, and everybody have a great week.